So welcome to Transform Gov, the Digital Government Podcast. And Transform Gov is part of the Ireland e-Government Awards, and it's brought to you in association with Accenture. I'm Maeve Neefsey, and on today's episode, I'm joined by Deputy CEO and Chief Technology and Transformation Officer for the HSE, Damien McCallion. Damien, you're very welcome to Transform Gov.
Thanks very much, Maeve.
Look, you started off your life in aviation, obviously a natural transformation into healthcare. But anyway, how did you end up transforming the health service, having started in aviation? Tell us about that journey.
Yeah, I guess I started like a lot of people back in the 80s in college, did computers. I wouldn't say it was the first choice, but that's what I did at the time. And then like a lot of people, I suppose, after working for a year or two, had to travel and probably had a desire to travel as well, a bit like people do today.
Yeah.
So I went to London and worked with British Airways and ended up staying there for about 10 years. Great induction as a sort of second job, and lots of opportunity, I suppose, in terms of travel, learning, working in different areas, sales, marketing, digital, all sorts of different areas. So interesting industry. At the time, British Airways would have been the world's favourite airline, was the catchphrase.
They were like the airline, weren't they?
Indeed, yeah. I think the only thing we did wrong was I remember Maggie Thatcher didn't like when they put these international flags in sort of different colours and tartans and so on the back of the plane. She famously once at a campaign put a handkerchief over the back of the plane that just killed probably many tens of millions of pounds of marketing. Yeah, so that shattered it. But it was interesting when I left, the .com thing was just starting to take off.
Yeah.
So it was interesting in how aviation changed with the low-cost carriers, Ryanair and others, and the whole model changed. But the BA model, a lot of the profits, a lot of the income was generated through that high yield corporate arrangements and so on, which would have been one of the areas they worked in. But they were very good when you're starting out like that in terms of management development, opportunities, learning, as I say. So great company to work for. You got to see a little bit of the world, which back in the 80s was probably more rare than it would be for many of your listeners today. You know, there wasn't that same opportunity to travel. Airlines were expensive.
Very.
So you had to subsidise travel as well. And I flew a lot for work. You know, you'd often go to New York in an evening, you'd be back in the office in London the next morning with the time change to your meeting and literally straight round. So it was always lots of different opportunities. So worked in lots of different areas there, gave me a fair bit of learning. And then I guess, you know, the desire to get back home at some point, had 2 kids in London, 2 lads. So choices came up, an opportunity came up and moved back then and joined the health system here.
I suppose in a way, aviation, in a kind of a roundabout way, is you're dealing with a lot of crisis, aren't you? And you're dealing with things on a big scale. And it's life or death in a way if things don't work out. So do you think that laid a good foundation for you to move into healthcare?
Yeah, it's probably less crisis, I think, in the sense that like aviation was all about trying to keep that routine and regular rhythm to your operations, you know, in terms of whether it's the engineering side of the business, the sales side of the business, the marketing side or the operations in terms of keeping the planes in the air and turned around. So it's very much operational. And I suppose that's the one thing that you realise, like, it's all about keeping the planes moving because that's essentially how you're generating the income, that's keeping the business, you know, and making profits. That's ultimately what private companies are about. So I suppose in that sense, it was a good grounding and a good learning, and to see maybe different cultures, different countries, how they approached it. And we had a number of mergers, took over a number of carriers in that time. You talk about culture. I can remember going when we were proposing to do a joint merger with American Airlines, subject to the Competition Authority, frowned on, and you couldn't have a too greater contrast. We flew into Texas, and I think the American Airlines guys came out almost, I'd say they maximised the hats, the boots, the whole lot. And we had, if you can imagine, a bunch of Europeans, largely British people coming in suits. Yeah, so it was quite a contrast. And actually the Competition Authority ultimately didn't allow that to go ahead. But aviation has, if you look at it now, there's a lot more mergers. Aer Lingus are part of that group, AIG, strong Irish presence there over the years as well, people like Willie Walsh and so on. But for me as a first job, it was a good grounding in operations in terms of areas like sales and marketing, the importance of getting your message across. And then on the technology side, I worked there as well about, you know, how do you actually pull information together about people to maximise the business in that case in terms of corporate deals, how you actually pulled information about all of these people. Big companies like British Petroleum would have thousands of people flying around the world and they're looking at which airlines can give them the best deal. And how do you even identify those people? A bit like patients today. How do we identify the patient across our hospital system and healthcare system? So lots of parallels. The
complexity in a way is similar. But are the things that you didn't expect that were very useful to you when you were in British Airways that you could bring?
Yeah, I think when you're younger, you're a little bit rawer and you're probably more open to lots of things at times. So certainly for me, there was a lot of learning personally, professionally, and as the industry, I suppose. One of the talks I gave recently was at our National Maternity Conference, and I was comparing, if you look at aviation, it's got safer every year. We have less deaths, we have less accidents, and technology has played a part in that in terms of whether that's in terms of air traffic control, the planes themselves, or the whole system around, flying in terms of the actual operations. And if you look at it, and when I looked at the data, like every year, and the data is really important, literally, I think bar 1 year, the number of accidents, the number of fatalities, and obviously if a plane crashes, unfortunately, it is fatal. So you have to be very conscious of that. But they've dropped year on year through safety. Part of that is culture, which you could again apply to the health service. Part of that is technology assisting. So when I worked at the airline first, there were probably 4 people in the cockpit of a 747. You'd have had engineers in case something went wrong. Today, technically, the plane could probably fly itself. But how many people would go up in the air
if they didn't know there was
a pilot?
Cockpit,
I asked that question several times at different meetings or events or whatever, and you always get a mixed response. Some people are quite happy. Some people would be very nervous about not having that option there. So, but it shows you how technology is assisted, but as part of a cultural shift and an absolute focus on safety. And actually, one of the things that started off years ago from aviation was the concept of a checklist. If you think about it, we've all watched the movies or been in a flight and they're checking through all the pieces.
Roger.
Yeah, but that's all been brought into surgery over the years, way back many years ago. Some of those ideas have translated into healthcare as well. So I think there's comparisons about how, if you take the culture and you take the technology, you can help make healthcare safer. So from our perspective, I suppose a lot of the digital investments we want to make in healthcare are driven by that desire to make the system safer for patients and for staff as well.
And on a personal level, I mean, if you think about, actually, a lot of the interviews we've done on the podcast and Transform Gov are people, like yourself in senior important positions within digital transformation in particular. And in my assumption, which is completely wrong, was that these are people who must have been in the civil service all of their lives. But in fact, that's not the case. There's a lot of people who've come from very different backgrounds who've come in and obviously contributed massively to the public service. But did you have a cultural shock coming from something like British Airways into the HSE and the health service, or did you find that fairly straightforward?
I think at the time, like anything, when you're moving countries, you're moving employers, you're moving from one sector, private sector, to the other, to public sector, it is very different, and you have to get your head around it at the time. And at that stage, you had different health boards. So the challenge was trying to get consistency, and there was a big push at the time to try and get consistency across the different parts of the health system. The government of the day were, I remember, frustrated that, something could work in one place and it was difficult elsewhere, or there were problems and they couldn't get that consistency. And the HSE was born out of that back in 2005, that whole idea that government wanted to get a consistency to the way that you get rid of what might be called sometimes the postcode lottery. So I wouldn't say it was a frustration, but it was different. And like any role when you change, or any organisation where you change, you've got to understand the culture, the way of working and things like that. And look, I think the key thing there is to develop relationships and people who can give you a steer and guide through perhaps the nuances of every organisation, because every organisation has its own culture, and something as big as the health system, often you'll have different cultures in different parts of the country as well. They've developed in different ways. Some perhaps have different models as well. Maybe they're more directly delivered services than maybe where in some parts of the East Coast where you have a large amount of the services delivered through large voluntary providers. So I think the key thing for me is understanding the culture, getting to get your head around it, building the relationships that enables you to get things done, and then trying to move through that from there and adapting. But I think every time you move jobs, you learn, it's different. And I think there's also things you can take with you as you move. So I think having people that have come in from outside for me is always a good thing. Having people to move around the system is a good thing. It brings fresh ideas, new thinking, and that can be balanced then with the stability perhaps as well of people who've worked in the service for a very long time.
In terms of that relationship building, it's such a woolly thing. I'm not saying you're saying it in a woolly way, but it's a woolly thing for people to try and get their head around. But when I was speaking to the Digital Repository of Ireland, which was the first time they had to try and, they'd have, 12 stakeholders that they had to get digital repository assets to work with them. And she literally had a list and went through everybody and built relationships very actively with each of those 12. Did you have a similar approach, or how did you start to kind of build those relationships?
I think, I suppose as time has gone on, you'll see different methodologies have developed, and you have, great terms, stakeholder mapping and lots of things, and you map out stakeholder plans and you engage people formally and informally and all of those things. I guess as you move through the system and you move through your career, some of that becomes probably a little bit more instinctive. It doesn't mean you don't step back and look at times and make sure, well, are we covering all our bases here? Are all the right people involved, formally or informally? Identify people as ever who are going to be supportive of what you're trying to achieve, people perhaps who might influence but are maybe less keen on this at the moment. And equally important are people, if you can turn them, are people perhaps who are not quite in favour or supportive of what you're trying to do. So I guess over time I've moved from the sort of more formalised, that similar thing where you look at your list and you say who are them. You may do that in your mind, or you may write it out, or you may actually have a whole project methodology. I suppose as you move up, what you have to try and do is make sure those things are happening through the various methodologies that are there. People appreciate the importance of it. Don't over-focus just on the technical side, because usually while the technical side can be problematic, most of the time if things don't deliver the value you're looking for, it's actually down to people rather than the technology. Not always the case, but majority of instances, most of this is about getting people to adopt it, to use it, to make it work. And I won't say you have to assume the technology works. That's a very big assumption, but I think making sure that the checks and balances are in around that as well. But most things succeed or fail around the services and the people that you're going to use them. Have you engaged them? Have you involved them? And again, there's a balance there. You can spend a long time doing that, and then the whole thing gets protracted and drawn out. So it's always a fine balance, I think, in terms of how you look at it. So there is a formal piece to it, yes, definitely, like you described. And you have to try and make sure that's systematic when you're in a large system like the health service, that's been ingrained in all the programs and projects you're delivering. People are conscious of that. There's a process they go through. There's people who can support and advise them around that, perhaps, because sometimes they're under pressure, might not think and see some of those things, and they're the very things then that catch them out later.
Look, I'm going to have to take a break, but I want to come back and talk about culture again. So please bear with us. We've got a message for you, but we'll be back in about 2 seconds.
Through the power of cloud, data and AI, Accenture is helping the public sector by blending human ingenuity, technology and a delivery-focused culture to turn their ambitions into action. Be ready for any challenge by adopting a continuous reinvention mindset to deliver human-centric services that adapt and grow with your needs. Contact the team at Accenture to find out more.
So we're back with Damien McCallion from the HSE, and we were talking about culture. So we spoke to Wendy Walsh, who is the kind of the people person as part of Accenture's team, and she was saying one of the things that she does straight away when they're going in to do a fairly big transformation is a lot of what you talked about in terms of getting people involved. But she also talked that she tries to pick out the person who's probably the most resistant and kind of work with them. Why is that so important? And would you take a similar approach?
Yeah, I think ultimately if you can bring someone who starts off maybe perhaps more, I won't say negatively, but maybe more questioning or challenging or maybe not as bought into it, if you can bring them around, then typically their peers will go, it has to be a good thing. So it's always balancing the people, certainly with digital as well. You'll have people who are quite evangelical, very progressive, have worked in it in other countries. You take healthcare, we have lots of our clinical staff who've worked all over the world on full electronic health records, no paper. And they come back here and they've said to me, God, like we're stepping back. So in some ways, they're the people who'll go forward. So you do need to look at who are the people. Resistance maybe is too strong a word sometimes. 99% of the time, people aren't resisting for the sake of it. They'll have some issue that you need to get to the nub of and try and identify that. I think when you're looking at it across a whole system, though, you have to make sure that each of your programs and your projects are considering that. You engage people in the formal governance structures on it so they're bought into it, and whether you're selecting a product or rolling out a product or testing a product or whatever it might be, or changing the processes or the way of working, that people are involved. And then the informal piece is also important. Who are, as you say, are the influencers? And I think that's what certainly we'd be encouraging all the time our program leads to do. What we also try and do is make sure the health service probably has some nuances versus other public services. So you'll have someone from the service side who's looking at how do you drive out the value and the benefits and so on. You'll have someone on the digital side who's going to try and make sure we deliver the solution and it works. But we also have the clinical dimension, which is really important. And we've coined a phrase recently on our electronic health record project, which is that it should be patient-centred, service-driven, clinically led and digitally enabled. So it's sort of a bit of a catchphrase, but essentially it's catching all those sort of elements.
It's a checklist.
Yeah, it is. It is. At a high level, it's a checklist. And then how do you apply that to the project and work it through,
Yeah.
And some of the big programs will have enormously complex governance structures with hundreds and hundreds of people involved in various working groups. If you think of it, if you're deploying an electronic health record, you'll need people who are dealing with some of the community services, diagnostics, the whole patient administration processes and so on and so forth. So Northern Ireland are actually going live in the next couple of days to finish their last 2 trusts. They'll have 2 million people live by the end of May under full electronic health record after about 7 years. And when we were up there recently visiting them, like literally their structure in terms of the number of groups they had to use to map out the pathways and processes to move from paper to digital, well in excess of probably about 150 groups across all of the areas. And they're focused on the service. What is it in mental health service, adult, mental health, kids, acute diagnostics, laboratory, and so on. So
there's 2 questions around that. One is, let's talk about why. So if it is, and you believe it is, which I think you do, why electronic health records are so important. But then the other side is how, when you've got so many people and so much complexity, Are you using certain technologies internally so that communication flow is easier? So maybe start with that one.
Yeah, so we would have a methodology that we use, and we have all of the normal project management office, value and benefits people that look at this. And that's the key thing for me is be clear on what you're trying to drive the value. If you can't say it on a page, or you can't say what's the major benefit going to be, if it's about safety, if it's about quality of care, if it's about efficiency, improved for staff or for patients. So basically, we have about 7 headings using a framework. We try and quantify what's the value of the project. Keep that in your mind, because the danger otherwise it becomes about the implementation and the technology, and just try and keep drawing that out. And it's one of the key things that we're trying to do. And I should have said earlier, like government signed off last year on a strategy for healthcare called Digital for Care 2030. They've made significant investment in this, and that's really setting out now the roadmap for the next 5 to 6 years. And I think that's really important that there's that commitment there. And we're now starting to, and look, it will go beyond that. But I think if you look at it in 5 to 6 year tranches, that's a reasonable period of time. We're a long way back. We're bottom of the EU 28, so we have a lot of catching up to do. But we're starting to try and accelerate various projects. Our diagnostics around our national imaging. So, for example, by the end of this year, every hospital, the last 3 hospitals, will be connected on to our national imaging system called NIMS, and there's a huge amount of work on over many years by teams before we had this strategy. But that will finish this year, which means if you're in Kerry or Letterkenny, your image, if I had a head injury, that can be read in Beaumont. You can share images all around the country. You can get specialist opinions. So it opens up a huge amount of benefit from a safety, quality of care. And of course, people might remember back years ago when you went in with an image in ED, you looked up and there was a piece of an actual film held up under a light to look at. Now that's completely digitized. And that's what sort of transformation's about. And similarly, then we've a range of other programs as well. So I think that methodology, go back to your question, is very important, and we're using that. We have a central hub, digital transformation office, that tries to drive that out, keep that consistency of delivery, keep focusing on the value. Lots of challenges along the way, because this isn't about the technology, it's about changing the way we're working across a whole range of services. So just think, if you're a radiologist 15 years ago, you were reading the film there, you were requesting the film to come up from maybe some dark room that had thousands of these to try and see was there a previous scan to look at it against, and so on. Now it's completely automated. Artificial intelligence is starting to come into play, offer up opportunities to support clinicians. So that's really about what transformation is about.
And there's clinicians, from my understanding of talking to other people with other projects around health, is that they're very keen to use technology where it can improve things rather than being resistant. Would that be fair?
Yeah, I think like a lot of our clinicians have worked, not just doctors, but nurses, therapists, and so on, right across the board, dentists, pharmacists, ophthalmologists, you name it. They've all worked, many of them have worked in other countries. And they also use technology, medical devices, which is becoming a grey area in the case of healthcare between what's a computer and what's a medical device. They're typically all integrated now in terms of giving you that information together. So if you go in to get a scan, the image is actually captured within the imaging system, made available through one monitor, and so on. So there's a lot of convergence, I suppose, in healthcare that perhaps other parts of the public system wouldn't have like that. So our clinicians, they're the people that are demanding this, but it's still important they're engaged, because what you're trying to do is get standard pathways, standard processes. If you have 55 flavours of doing something, that's going to cost you a lot of money to have that level of variation. So what we focus on is, and we have national clinical programs under our chief clinical officer that help with this, and we'll need to do more of this in terms of the electronic health record, is standardise the pathways of care so that it makes it easy to roll that out both for staff, but also for patients. And ultimately what we want to do more and more is put that information into the hands of patients so that we all have that, as we do with lots of other things on our phones and on our computers.
We have to go back to this now. It's a perfect time. I don't want to rush into this one, because it's very interesting what's going on. So we're going to take a very quick break, because we've got some news about entering the Ireland Government Awards, and we must make sure everybody knows how to do that. So just give us 2 seconds. Okay, it's time to stop putting it off. If you're thinking of entering the Ireland Government Awards, now is the time.
Yeah, don't wait. Get your entries in before the rush. The deadline is coming down the tracks. It'll be June the 2nd.
And believe us, there is a project for every single innovation, like digital inclusion, AI in local government, AI, and we've even got a category for digital projects that don't fit into any category. So it really is one for everybody in the audience.
And this is not a moneymaker. Entry is FREE, free, and it's about you and your team. Your project deserves to be recognised. That's what the eGovernment Awards are all about. So go to our website, digitalgovawards.com, and enter, where we've made it so easy.
And of course, don't forget, this is all thanks to Accenture, our fantastic sponsor. So we spoke a little while ago just about the EHR, electronic health record. where are we with that? I mean, is that far away? Tomorrow? 5 years?
Yeah, so a couple of things on that. So firstly, over the last number of years, we've developed the electronic health record in our maternity hospitals, standalone, the dedicated maternity hospitals. And that's been a huge success. There's a lot of evidence around higher safety, less errors, better for staff. And with the advent of the health app this year, we're able to give patients, women, their appointments.
I mean, I've heard a bit about it, but tell us a bit more about what it'll do.
Yeah, and I'll come back to that if that's okay, maybe in a second. Just on the wider electronic health record for the entire system. So I suppose what the maternity electronic health record has done is proven that in Ireland, it has a big benefit for staff, for the service, and for patients. I'll come back to the app in a second. On the wider system, then, our community services is Spartan. It has very limited technology there to support our staff, and that's over half our services. We have to remember that. Hospitals are just slightly less than half. Community, be it mental health, disability, primary care, social inclusion, and so on. So there's a huge range of services there that we're not really providing the type of solutions they want at the moment. And the integrated electronic health record, which we're finalising the business case at the moment and working with our Department of Health on it, is to develop that and implement that in our 6 regions that we have in the health system. So this year, the health service, or last year, moved into 6 regions, and we're going to start in Dublin North East and deploy it there. Each of those are big organisations or big areas in their own right, but our plan then is to get to tender at some point later this year, hopefully to commence some sort of process subject to approval with our colleagues in the department and with government. So that's ultimately where we want to get to, an integrated electronic health record. And what that will allow us to do then, it will mean that wherever you turn up, I live in Sligo and working here in Dublin, if I had to go into hospital tonight for something, they would have access to my full records. They would not only just have access to the record, they would actually be able to make referrals, maybe get my diagnostic booked in at the weekend, whatever it may be around the system, link between the community. So it offers huge flexibility. And the basic driver for what we're trying to do there is whether I'm a staff member or a patient, anywhere that I go, any service, hospital or community, we'll have access. People will have access to that. So that's the bigger plan. But the maternity has been very successful as a first step on the way to that journey.
Okay.
The health app then went live in the first quarter of this year. And that's a development that's going to allow patients. Initially, it's got a limited range of functionality, but it's about getting it out there and getting it used. It has all of your cards, your EHIC card. So I'd encourage people to download it because that's helpful if you're overseas in the summer. EHIC being your health insurance card.
Is this your EU?
E111 or EHIC card that's there. So that's really advantageous. Your medical card, your drug payments card. It has your vaccination details. And then because we had the electronic health record for maternity, we've been able to give women their appointments then as well through the app. So they're able to manage their appointments through that. And again, we want them to be able to actually interact with that in the future, request changes and so on. So we have a roadmap for the app that will build out.
So no more phone calls then and trying to get through to the right
I'd never
person.
say we're...
I mean, let's say not relying solely on phone calls anymore.
Yeah, and I guess if people can interact through the app that's there, we are conscious then as well, like we're a public health system, so we also have a responsibility of people who mightn't be familiar with that technology. So we have our HSE live and there'll be other ways for people to interact. But as much as possible, and the NHS have been really successful in this, you know, whether it's your screening appointments, linking it perhaps to your diagnosis, that the app can assist you and you can trust it. And one of the things in our initial survey that we discovered is people do trust the fact that information's coming from the HSE, it's certified. You go into Google, you don't know where that information is going to come from. So our vision for the app is, as the electronic health record develops, more and more features can be added to that, more and more information about your care, to the point where you can manage a proportion of that yourself and support people then in terms of giving them their information about healthcare rather than paper flying around the system. So it helps the patient, helps staff as well, and helps the service.
Okay. Well, look, I think we're going to take a pause here. And I think that there's no way we can do part 1. We've got to do part 2 because there's so much to cover. But I suppose I'm just conscious that there's a lot of other things to talk about, just about digitization. But, and of course what you saw before, but where are we in the EU? Did you say we're bottom of the rung? Sorry to be negative, but
yeah, no. So in
why
terms
are we
of
bottom of the rung?
I guess part of it is in terms of, you know, if you want to move up through the ladder of the EU states, effectively where we've got to get to is that we have actually got electronic health records. That's ultimately one of the key measures. There's a number of measures that are there. So the programs that we're putting in place now will assist us to get there. I suppose ultimately that's just a fact of life of where we're at the moment. The key driver for us shouldn't be the table, but there are obligations coming under the what's called the European Health Data Space. So we will have obligations as a country to meet in terms of being able to share records, not just within Ireland, but between jurisdictions. So by 2030, actually, we will have to allow certain health information to be exchanged between all countries in the EU. So if you're on holiday somewhere, at least a base set of information would be made available to you if you wanted to provide that yourself.
I'm definitely downloading the app. I mean, I think there's lots of stuff that will get added to that.
Glad to hear
but look, let's take a quick break. Well, obviously a break for part one. We'll come back to part two. Damien, fascinating so far. And thank you so much for coming on to Transform Gov. And before I go, I must also thank the studio. So Peter Rice, who's the studio manager, video editor Neil Horner, sound engineer Lee Brennan, and also videographer today, Lee Brennan, Mr. of two hats. So thanks as always to South Dublin Podcast Studio. And we'll be back to you again with part two with Damien McCallion.